Plastic surgery versus natural beauty part 2. Let's talk about it again. So I don't know if it's been in your feed, but it's definitely been in my feed, in the YouTube universe, the Jubilee video or the middle ground video on plastic surgery versus natural beauty. When I started my own YouTube space in the YouTube grand universe of it all, I started with this very question. And so what a great time to just double back and see if I agree or what I agree with. Now I know that there's a plastic surgeon already involved in this particular video, and I have read the comments and they were a little harsh maybe, but let's see if I agree with the harsh comments, okay? Let's get into it.
I know a girl who got a chin implant, changed her whole face, like crazy.
And no matter how much cosmetic surgery you receive, you're thinking of little things you can change about your body constantly.
Why does somebody else changing their face bother somebody who's happy with themselves?
I'm Ka Takahashi, and I'll be moderating this episode of Cosmetic Surgery versus Natural Beauty. The first prompt is, cosmetic surgeries should be as normalized as makeup. Can the agreeers step forward?
I kind of see a lot of cosmetic surgery as kind of like high maintenance to be low maintenance type of thing. So girls who are overlining their lips every day, like just get some lip filler, like get the, the Botox or anything. I mean, it kind of starts with makeup, like the girls who are putting on the makeup every day before school when they get a little more money in their pockets and they get a little older and get a little freedom. Yeah, those are probably the girls that are a little more inclined to want to get, stuff done. It's a little more severe to go under the knife than to wear makeup, but I mean, it's something that happens every day. It's LA, and I just don't think people talk about it because it's so taboo.
Originally, the prompt said surgery, and I don't think surgery should be normalized, but then you started talking about like
Botox,
yeah. Lasers, skincare products, friends and acquaintances that I know who also are aging gracefully. Somebody gave them the secret when they were in their 20s. Our collagen starts going to shit at 25. So if you're not doing things that boost the collagen in your skin at the age of 25, you're gonna be playing catch up at some point. If there's something that you could have done, like regular exercise or stretching every day to help you age better, why not do that for your appearance if it's simple, safe, and you're doing it with a trusted physician?
But surgeries, you would say, that should not be normalized.
I don't think it should be normalized, but I'll give you an example. This is gonna sound crazy, but go with me. So I had a girl brought in by her mom for a labiaplasty. And I was ready to walk in the room and be like, are you freaking crazy? Like, what are you thinking bringing in your daughter for a labiaplasty? And I walked in and this girl had a normal labia on one side. And on the other side, she had a labia as long as my finger hanging out. When she was at the YMCA, it would fall out of her bathing suit. She was getting teased by her friends. And she said, Mom, I do not want to.
So one of the comments, or several of the comments that I saw were about Dr. Nazarian using kind of these more extreme examples to kind of try and normalize the idea of plastic surgery. So here's what I think. I do think that in that example, it wasn't a great example, right? Having a labia that is longer than you would like is something that can happen. We are all born with two of many things, and those things that come in pairs don't always come symmetrical. And oftentimes there is asymmetry, right? And that asymmetry can be very minor, it can be very major. And in this case, she's talking about a very major asymmetry that frankly is not necessarily cosmetic in nature, right? Because having a long labia that falls out of bathing suits is not necessarily just a cosmetic issue. It can also cause chafing and things like that. So that I would consider more reconstructive. So when we're saying cosmetic surgery, I don't think this example applies. And I do agree that in this case, that the example is a little bit more extreme than what the initial question posits, and that is, should cosmetic surgery be normalized? My answer to that would also be no. We should not normalize people going under the knife like we do makeup. I do think there are all types of things that we do to present ourselves to the world in a different way, or in a zhuzhed way, for lack of a better word. But I do think that cosmetic surgery falls on the extreme of that, and so in that sense, no, we shouldn't normalize it. Should we normalize maintenance? Yes, but I think maybe we disagree on what that is. I don't know that Botox and filler are necessarily maintenance in the way that going to the gym is maintenance. So there I would argue.
I go into high school with this thing hanging out of my vagina. I did it awake. It took me 15 minutes to give her a normal anatomic labia that matched her other side. So should we?
I also don't like the words, in plastic surgery, using the words normal versus abnormal. I think it's actually a really, really bad practice, right? What we've learned over time is that there are differences. We all have differences, whether they be in our face, our bodies, whatever, that make us a little bit different from our neighbors. So I don't like the word normal versus abnormal. That may be me being nitpicky, but especially working with people who have craniofacial differences, it strikes me as a little bit of a bad setup to say that one side or one thing or one way is normal and then another way is abnormal. I wouldn't call a cleft lip baby abnormal, so I also wouldn't call a longer labia than the other side abnormal either.
Normalize access to feel your best? Absolutely.
Bring the.
I agree with that.
I think plastic surgery shouldn't be demonized, but it also shouldn't be normalized totally, completely either. In that way, stealth can also be quite dangerous for people because people are dishonest about the work they get done, and they give this unrealistic beauty standard. I didn't know a lot of girls had BBLs when they were selling workout plans, things like that.
Totally.
BBLs.
Yeah, Brazilian butt lift, which is what I have two of.
Okay.
I don't think plastic surgery is wrong. The little girl you're talking about, like, we can all imagine what that would be like, having some kind of abnormality in your body, or if you have a cleft lip, or something that makes you feel so othered.
So again, I'm gonna stop there and say I really don't like the words abnormality. I don't like anomaly, I don't like abnormality, I don't like deformity. These are words that we've used to make ourselves feel better about doing plastic surgery, right? We are saying this person is born with a deformity and so they need to be changed to look more normal, but that's not, that's really cringy and really not right, right? They have a craniofacial difference, and that difference can affect them in a myriad of ways that I think necessitate consideration of surgery. But again, using the word normal versus abnormal, bad practice, don't want to do it. I hope that I don't have to keep stopping to say that, but here we are.
Can understand that. My issue with the idea of normalizing surgery, you have young girls. When you're 18, you get to decide if you're willing to take on the risk. 18-year-olds don't really know anything. I don't want a society that tells young women especially, you need to change these things about yourself surgically.
So I think it's very important.
So I think that's very true. I think the idea that we should normalize plastic surgery is not a good idea, right? And I think she says that. I think going a step further to say we should normalize not being so critical of other people for their differences is another way to go. And unfortunately, it's easier to talk about plastic surgery than it is to talk about societal kind of demonization of people, of differences. And how we do that it's really hard to conceptualize, right? And so then we have these discussions about how should plastic surgery fit into our lives, when the real question is how should we stop being dicks to other people?
That we make a
Distinction?
yes, there we go. We got it. It was there between makeup and surgery, because that was the prompt, right? I've been faced troubles when I was doing certain surgeries, right? And I had to redo things. And I think once you go down that slope and that route, it goes into like another tunnel. You know what I'm saying? Makeup, it's something that's so easy we can take it off, we can put it on. So that's the only reason why I disagreed. I don't think it should be as normalized as makeup because it's just two totally different ball games.
I completely agree with you, and to a certain extent, I would say, looking at like the makeup industry, makeup in a lot of ways is a little bit too normalized. So I don't think I would want to take that a step further. And if we're normalizing makeup, which in a lot of ways there are women and men who can throw on makeup and it changes the entire shape of their face, and you take it off and it's a completely different person underneath. Surgery does that in a more permanent, invasive way. The goal is to move away from alteration of the self, of the person, and move towards, acceptance.
So alteration of self and permanency are two things that you brought up. Would you apply the same to tattoos and piercings?
Yes, and I say that as a person who has tattoos, and in a lot of ways I look down and I think about myself and I go, why did I feel the need to change this, person that I was?
Self-expression, though, what you wanted to visualize.
Yeah, I think it was a convinced self-expression, and we talk about aging, and the phrase "age gracefully" was used. When I think about aging gracefully, I think about somebody who is looking at the wrinkles on their face and going, "Oh, that was a laugh that I had back when I was, 23. This mark that I have on my stomach is from my child who's now in his 30s." Why don't we view that as aging gracefully? Why is there no grace in accepting the wrinkles?
One wrinkle or seeing a little mark on your belly is not what these women are coming in for. I've had patients who are so blown out in their abdomen that you can see their intestines moving under their skin after they've had 4 children.
So again, I come back to the comments because I'm just going off the comments. Yeah, this is not, no, I'm kidding. This is my personal opinion too. But that's an extreme example. It's not typical that I meet. Well, I actually might meet them because they're coming to my reconstructive clinic, right? They're not coming to my cosmetic clinic. But it's not typical in a cosmetic setting to be seeing patients with such blown out abdomens. It's really more common that they have a little bit extra as something that they want to remove or, fix. So I do agree. She's, again, using kind of extreme examples to justify cosmetic surgery. And I think most of us would agree that there are levels. There are always levels to this, right? And so if you're saying that I can see your intestines moving through your skin, that's a very different level from I have a little bit of an extra baby pooch because I had 2 babies and I feel like I'm not who I used to be. But let me not make the distinction here. I think both women are justified in wanting to present themselves to the world differently. But again, using this example is cheating, right? It's cheating. It's just cheating. It's cheating. It's not gonna work.
So is that okay now? Or maybe there's like this one definitive spot where like this is okay, but this is not,
Right, exactly. What is that point? And I think it's a personal question. What is that point for you? Again, I think a person who wants 1 or 2 surgeries, perfectly justified. A person who wants 5 or 6 has to start thinking about what they're missing in their lives that makes them want to seek surgery for acceptance in that way. There are levels, but the problem is who decides that level? We don't decide. I don't decide that level for you. You decide it for yourself, right? I, as a plastic surgeon, and you may come to me and say, I want these 5 things done. And I would say, well, let's back up because I think you missed a step. And I don't think that I can necessarily solve your problems. If there are 5 things on your body right now that you can think of that you want to change to the extent that you would pay someone to do that, I caution you that the problem is not your body.
In the
And
non-plastic
who's gonna
surgery,
determine
who
what's
determines
right?
that?
Yeah.
You don't want to demonize the plastic surgeon. You don't want to demonize the plastic surgery. You don't want to set arbitrary posts for when it's okay and when it's not okay, or
I
how
agree with
bad
that.
it is before you do it, or how bad it's impossible.